PAWS is what we usually call it. It's post-acute withdrawal syndrome, and that is a great big old mouthful. PAWS is a lot easier. And it's a constellation of symptoms that people experience as their nervous system and their gut microbiome and everything else heals. It's a constellation of symptoms that people also experience while their body's healing. Their neurotransmitters are kind of out of balance, and they're trying to deal with traumas and resentments and anxieties and other things. So they got a lot of crap going on. They really do, which would make just about anybody feel apathetic, exhausted, just feeling unwell. I just don't have any get up and go. I just feel cravings for use. Well, the use generally supplied increased serotonin, increased dopamine, increased endorphins. So when you're feeling unwell, apathetic, unmotivated, it makes sense that your body's going, hey, I know how we can fix this. Irritability. When we're stressed, we trigger the stress response system. When the stress response system is triggered, we are triggering those irritability chemicals. We tend to be more easily agitated. And remember, going back to that bucket, when we are in, well, even when people are using and in early recovery, there's enough going on in the body, in the mind, in the relationships that they have got that bucket filled up with stress. So it doesn't take much to overflow the stress bucket. And when people are in early recovery, not only is their stress bucket up here, almost full, but you've taken away, or they've taken away, the one tool that they've been able to use that's actually sort of numbed the pain so they didn't overflow. So yeah, we're going to expect more emotional lability, more irritability. Unfortunately, PAWS can last for 1 to 2 years post-detox. And you're like, excuse me? Yeah, okay. But the good news, it doesn't last in the same intensity and duration. People who experience PAWS the first 3 to 6 months, depending on what they used, how heavily they used, co-occurring issues, etc. First 3 to 6 months can be pretty tough. It can be very gray. They can feel very irritable and feel like they've got more of a hair trigger. They dysregulate more easily. As their body starts to heal, those episodes of irritability go down because they've essentially drained some of their stress bucket. So they've got a little bit more room to work with, but their body is still miscalibrated. Their nervous system is still miscalibrated. So there's still a lot of stress on the system, and we're not going to get that stress bucket as low as we would like early on. It's going to be easy for them to fill it up and overflow. Okay, that's fine. But what we see with PAWS is as people heal, they're draining that bucket, and the intensity, duration, and frequency of their PAWS symptoms goes down. The intensity, frequency, and duration goes down. So what we want to look for is gradual progress. And I always try to make the analogy with a physical condition. After somebody has a stroke, you don't expect them in a month to be up running a marathon again. Probably not very likely. What we want to look for is gradual improvements in their symptoms. Same thing is true in post-acute withdrawal. Some people really struggle with the apathy, with the cravings, with the frustration. And in their interpersonal relationships, a lot of times when their significant others see apathy, irritability, emotional lability, and just, not being really motivated, significant others often assume that means the person's using again. So we really need to do a good job of educating support people about post-acute withdrawal. And could it mean they're using again? Sure, it could. But we need to get FitCat, facts in this context at this time. what do we know? And what is the person doing? We don't want to accuse them of something that they're not doing. They're trying their hardest not to do. And how irritable do you get? I know I do. I get irritable if I know that there is a big piece of chocolate cake downstairs and I want it. And I know that, hey, it's after my eating window, can't have that chocolate cake. Do I tend to get a little bit more irritable? Yeah, because I want that chocolate cake. And chocolate cake is nothing compared to what a lot of people are addicted to. So think about how irritable they may feel when they're having these cravings, when they're experiencing this distress, and they know that there's something they could do to make it go away, but they're choosing not to do it. They're doing the next right thing. We want to support that no matter how cantankerous they are.